Good morning, welcome to Conversations and Coffee. Conversations and Coffee is where I talk about things that interest me. Some things are books, some things are just stuff that I have studied. This in particular is something that my doctors explained to me and I decided to look further into it, and now we're here. Major disclaimer, I'm not a doctor. Do not take what I say as medical advice. Today we are talking about nerve pain, EDS, and shoulder instability. A few things I want to point out before I jump into this. I'm going to be mentioning a study in here that is called the Management of Shoulder Instability and Hypermobility Type Ehlers-Danlos Syndrome. They talk about, and specifically only talk about, hypermobile type of EDS. I just want to point out, while it is the most common form, people with EDS in general are going to have instability of their joints, and hypermobility type is not the only form to have generalized joint hypermobility. Also, because if you do follow my channel, I did point out in one of my videos that I no longer talk about what form I have. We did find out recently that we were probably diagnosed with the wrong form. Anyways, moving on. Everything is going to be in the description below because I like to have backing to everything that I talk about. I have some pictures to the side here so we're all on the same page. So you have your normal shoulder joint and you have the capsule around it, which is the different types of ligaments that are surrounding the joint capsule. A patient presenting with low energy dislocation events, this can then lead to capsular redundancy of the glenohumeral joint. Different subluxations and dislocations that can happen, a posterior and anterior dislocations. The anterior dislocations is the types of dislocations and subluxations that'll start hitting the nerves. The nerve bundle that it'll start aggravating starts up here and it'll come down. So your brachial plexus is a bundle of nerves that stem from the nerve root in the neck and upper trunk section of the spinal cord. The nerves that branch off of the brachial plexus are the ones that come all the way down into your arm, which are the axillary, musculocutaneous, radial, median, and ulnar nerve. So your shoulder dislocations and subluxations, especially anterior, coming down and forward, can hit the nerves that are coming down here. And when they're hitting, this can affect the nerves in different ways. Your arm will sublux or dislocate sporadically, so the symptoms will sporadically happen. Patients may also present with distal upper extremity neuropathic pain, owing to traction of compression of the peripheral nerves. Just a single section. It says neuropathic pain. Nerve conduction studies are usually non-diagnostic. Skin biopsies may reveal reduction or absence of small nerve fibers. May be normal. One hypothesis is the neuropathic pain may result from direct nerve impingement by sublux vertebrae, herniated discs, vertebral orthoarthritis, or peripheral joint subluxations. So peripheral joint subluxations is your shoulders, elbows, wrists, hips, knees, ankles. That's two sentences. Anterior dislocations. Internal rotation and abductions are usually limited because of the frequent associations of nerve injuries and, to the lesser extent, vascular injuries. An essential part of the physical examination of the anteriorly dislocated shoulder is the assessment of the neurovascular status of the upper extremity and the charting of the finding prior to reduction. Two sentences. Shoulder instability and nerve pain, it hasn't been looked into much. It was really hard to find these. Nerve injury implies something that interferes with the health of the nerve. It implies that there may or may not be loss of function, but temporary or permanent. Damage implies permanent loss of function. Brachial plexus injuries are more rare with dislocations, but axillary nerve injuries are considered a little bit more common. Most axillary nerve injuries are low-grade lesions which will recover rapidly and often completely. There are some people that if you have a low-grade axillary nerve injury, it can take some time and heal, or there's some people who this is a little bit more severe. The gist of all this is just all these different nerve symptoms that could happen. It could just be shoulder instability. That is it for this video. Hopefully you guys learn something. Go on over to part 2 where I tell my story about some nerve things, what I dealt with before both of my shoulder surgeries, and how I'm doing now with the nerve pain as well. Hope you guys have a good day and a good week, and I will see you soon. Bye.